Good morning, everyone. We've recorded 9 new cases. 8 are linked and 1 remains under investigation. Out of these 9 cases, 3 were in quarantine during their entire infectious period, and of the remaining 6, we know 4 were infectious in the community and 2 are still being assessed. Fortunately, this morning can report an increase in hospitalisation. We now have 7 people hospitalised with COVID-19, although some are also being treated for pre-existing conditions. And sadly, 1 person remains in intensive care in critical condition. And our thoughts are with that person's family, and our thanks are with the staff who are working to care for that individual in the intensive care unit at Canberra Hospital. Yesterday was a very big day of vaccination across the ACT. Around 2,700 doses issued in ACT government clinics and around 2,000 through GPs and pharmacists. So this continues a strong trend of vaccination in the Territory. It's very important that this continues to give our community protection against the vaccine and against decisions that may be made interstate that have an impact on Canberra. There are now more than 17,000 Canberrans aged 16 to 29 years registered in the My Digital Health Record system for a Pfizer vaccine at an ACT government clinic. So that number continues to grow every day and that's a great thing. I encourage 16 to 29-year-olds to look at their vaccination options. There's AstraZeneca available today, but if you don't choose that path, please register with the ACT government to be able to get your Pfizer vaccine through an ACT government clinic. The vaccination program is going as fast as it possibly can, but we are still 2 to 3 months away from the level of community protection that mass vaccination provides. And what we've seen in our own outbreak and what's playing out around Australia and around the world is just how quickly one positive case turns into hundreds and then thousands in a community, particularly when that community is still largely unvaccinated. And even though we are leading the nation at the moment, we still have more people unvaccinated, as in not fully protected by 2 doses that have been in their arms for at least 3 weeks past the jab date. And so this remains our number 1 priority over the coming months, to get more people vaccinated more quickly. Now, today's case update, together with the data that we have from the last 13 days, regrettably means that we are not in a position to end the lockdown early. The lockdown will not be ending before the 2nd of September. So with this in mind, the Chief Health Officer is reviewing the public health directions for the week ahead. The 2-week checkpoint is tomorrow. Now is not the time to be significantly easing restrictions. However, some changes are being considered, and these changes will seek to balance risk across the community. We will announce the settings for next week before the weekend. Now, yesterday testing numbers were excellent. 6,695 tests conducted. All our testing sites are open today, with the Gold Creek School pop-up clinic providing targeted testing only to cohorts who are aware that that's where they need to go for testing. So in summary today, 9 new cases, 8 linked, 1 under investigation. That's a better outcome than yesterday, but these numbers are still going to jump around from day to day. We do not yet have a trend. 7 people are now hospitalised and 1 person remains in intensive care in critical condition. I'll now invite the Deputy Chief Health Officer, Dr. Vanessa Johnston, to provide an update on the cases and epidemiology And following Dr Johnston, the Minister for Health, Rachel Stephen-Smith, will provide an update, and then we will be available for questions. Thank you.
Thank you, Chief. Good morning. I'm Dr Vanessa Johnston, the ACT Deputy Chief Health Officer. As the Chief Minister has just said, since our update yesterday, the ACT has recorded 9 new COVID-19 cases, with the total active cases associated with this outbreak now standing at 176. While this number is clearly better than yesterday, we are still managing over 10,800 close contacts in quarantine. We will continue to closely monitor our high-risk exposures. It is critical now that Canberrans continue to do the right thing during this lockdown period. Get tested if you've got symptoms, no matter how mild they are, and make sure that you're following the advice about testing if you're a close or casual contact from ACT Health. Of these new cases today, I can confirm out of the 9, 8 can be linked to known cases or ongoing clusters. We know that 2 of the 8 are household contacts of cases, and the remaining 6 are linked to existing clusters. Out of the 9, 3 were in quarantine for their full infectious period, therefore posing no risk to the community. Of the 6 remaining, 4 were infectious for at least part, or in the community for at least part of their infectious period, and 2 are still being assessed as to the time spent in community. We now have 7 people in hospital, and as the Chief said, 1 is very unwell and is being ventilated in intensive care. Since our last update, we have over 10,800 self-identified close contacts in quarantine and over 5,500 casual contacts. We also now have over 400 exposure locations spread across the ACT, so please stay up to date every day with the webpage as new venues are being added every day. So I just wanted to provide a broader overview of our outbreak. At this time, there's very little change to the breakdown of the age categories announced yesterday for the cases. So that's 38% in people aged 0 to 17 years, 46% aged 18 to 44, 12% aged 45 to 64, and 3% are over 65. Yesterday, we added Bright Bees Early Learning Centre in Nichols to our public transmission sites, and today we are adding CIT Reid. This brings our total number of close exposure sites where transmission of COVID-19 has occurred to 10. So continue to check the exposure sites on our website. If you've been to any of these close contact exposure sites during the dates and times identified, please quarantine, get tested and fill out a declaration form. Before I finish today, I'd like to give a little bit of an update on quarantine. We know that a lot of close contacts are starting to leave quarantine after 14 days, and many more will be coming out of quarantine in the coming days. We've been receiving feedback overnight that some people have not received or been contacted by ACT Health about arrangements for coming out of quarantine. So we've set up a dedicated option on our phone line for those close contacts who believe they're eligible for release from quarantine but are yet to hear from ACT Health. This line is now active and information will be very shortly publicised on our social media channels and on our COVID-19 website. I know that people are looking forward to getting out of quarantine, and any delay is frustrating, but a negative test between day 12 to 13, that's our exit of quarantine test, is really critical before we allow people out of quarantine, because that's going to greatly minimise the risk to community. ACT Health will continue to process several thousand close contacts over the coming days, so we do ask people to be patient at testing clinics as people come up to their day 12 to 13 exit tests and as they wait to hear from ACT Health about arrangements for their release. Please remain in quarantine until you've had a negative test result on day 12 to 13 and you are contacted by ACT Health. This is necessary under the relevant public health direction. Before I finish, I'd like to acknowledge the great work of our vaccine teams. That's in the vaccine program and policy space, but also the booking and the clinic staff with a record number of vaccinations delivered yesterday across the ACT. These people are doing a tremendous job and helping us to inch ever closer to living in our new COVID normal circumstances. Thanks very much.
Thanks very much, Vanessa. So today we have some good news on the health workforce front. Our COVID-19 response will soon be enhanced with the qualified student practitioners now permitted to give COVID-19 vaccinations. And this is something that we've been talking about for some time, that we've been working with stakeholders to ensure that we could get student health practitioners into our workforce. So we've been working rapidly to expand the ACT's both vaccination and testing workforce ahead of the increases expected in vaccine supply. And that includes working across the ACT health sector with unions, with professional peak bodies and with our universities to bring later years students on board to assist in the ACT's COVID-19 pandemic response. With their cooperation, we have made changes that will allow the Chief Health Officer to enable specific types of student health practitioners to assist in our pandemic response workforce and specifically to provide COVID-19 vaccinations and to support the expanded vaccination effort as more supply comes online. Our COVID-19 response workforce is doing an amazing job responding to the current outbreak, and this will allow us to provide further support for the important work they're doing to keep our communities safe. This will start with the addition of enrolled nurses, student nurses and student midwives from today, and medical and other student health practitioners will come on board as soon as possible. And again, I'd like to thank all of the stakeholders who've been working with us through the industrial, practical and legal implications of getting this work done. So thank you very much. I'd also like to provide a brief update on the cases associated with the disability sector. Today I can confirm that one more positive case has been linked to the cluster in this sector, and this is a person with disability. Firstly, I'd like to thank the service providers in the disability sector who have seen positive cases in their staff and also in participants in their services. The service providers have been working very closely with our health teams and their response has been excellent. Their commitment to the safety of their workers and the people to whom they provide care has been outstanding. And I want to reassure people in the community who are living with disability that ACT Health and the service providers affected by these cases have been in touch with anyone who is affected who are considered close or casual contacts. This includes any of the workers who have been impacted. I also want to thank leaders across the disability community, particularly people with disability, who have been providing advice and advocacy for their community, and I want to commend them and thank them for that. I urge people in our community who are living with disability who have questions or concerns to discuss these with their service providers, or they can call the COVID-19 helpline on 6207 7244. Also just want to let people know that the Erindale Testing Centre is available today and tomorrow for people with disability or who are mobility impaired. So there is no need to call ahead, and wait times are currently quite good at Erindale. So if you arrive and you're a person with a disability or mobility impaired who has a specific requirement, please talk to the security staff when you arrive at Erindale and they will be able to support you to get the testing in a safe and efficient way that works for you. So with that, I will hand back to the Chief Minister for questions. Thank you.
Okay, who would like to kick us off this morning? Well, it's now this afternoon.
Yeah.
We'll start with you, Dominic.
You mentioned that we're not going to get out of lockdown early and we'll see some more updates as we reach that checkpoint. What case numbers do we need to look at before we can move out of that 3-week lockdown? You mentioned a run of 0 if we could leave 2 weeks. What do we want to see so we can actually leave next Thursday?
Well, that will obviously be subject to the nature of cases between now and then, but a good indicator is no one infectious in the community for any period of time. Links between the cases, so no more mystery cases, and an understanding that the step from lockdown to the next phase is going to be a gentle one. So it's not going to be that all public health restrictions will be removed. It will be that there would be a level of increased activity, but it will be a moderate step forward. So I mentioned this before, that the advice is that we will come out of this gently, week by week, as we continue to get our vaccination rate up. This side of the room, Jasper.
Chief Minister, you've made it very clear that the population in the ACT, including everyone over the age of 12, will form the decision-making basis for easing restrictions in the future. Do you think the national plan targets should be changed so that the population is 12 plus rather than 16 plus for everyone in the country?
Look, I've called for that. Where there are other jurisdictions, and the Prime Minister agree, will really be a matter for each of them. I know National Cabinet will be discussing the vaccination program for 12 to 15-year-olds. I know our capacity to vaccinate more teenagers is linked to the supply of Pfizer and Moderna coming online soon. And I anticipate it will be every state and territory's goal to vaccinate as many 12 to 15-year-olds as possible ahead of where when the nation reaches that 70 and then 80% population coverage of people 16 years and over. Now, in looking at both the Doherty modelling and the current sort of trend and pace of vaccination, the difference between 70% and 80% of the 16 plus population is likely to be about 3 weeks. Now, I've made the point repeatedly, and I think other First Ministers are starting to pick this up and say it themselves as well, that effectively it takes 3 weeks from the point you get jabbed with your second dose or your first dose for the vaccine to reach its maximum effectiveness. So a lot of the tension and public debate at the moment across Australia about what it means to cross 70%, 80%, or what it means to go beyond that and to strive for more, which is, I think, an important message that all politicians should be communicating, is that the national vaccine effort doesn't stop at 80%. We don't all just give up and walk away once we cross the 80% threshold. We've got to keep on going and trying to get more and more people vaccinated. But the difference largely is weeks. And so what I'm saying, that will be our approach, is that we will take those extra few weeks to vaccinate more people. Now, based on the current trajectory of our vaccination program versus the nation, I think we'll have those weeks before the rest of the nation reaches 70%, 80%, and then goes beyond. So thanks to Canberrans coming forward to get vaccinated, we're in a better position than any other jurisdiction to go beyond 80% and to vaccinate our 12 to 15-year-olds. But I am going to continue to advocate that at a national level, we all try our very best to vaccinate as many 12 to 15-year-olds as we can before big decisions are made, particularly at the 80% national threshold. But that, it would seem, hitting 80% nationally is probably not going to happen until the end of November. So between now and the end of November, the challenge for Canberra is how many more of us can we protect through vaccination between now and then. The race is on, Canberra. Please get vaccinated as soon as you can.
There were some COVID fragments found in the sewage in Merimbula. There's some speculation that Canberrans are to blame for that. Can you provide any clarity on that situation?
No, I don't know where the sewage fragments have come from. I mean, there's COVID all over New South Wales, so it's just as likely to be from New South Wales. I don't think the sewage detection is quite that sophisticated to be able to tell whether it's a Canberran's poo or someone else's.
On the AIS arena and turning that into a vaccination hub, can you provide any more of a timeline of when that work will happen and whether that will free up the Garran Surge Centre to return to its original purpose?
Sure. Look, as soon as possible, we're wanting to stand up that facility because that enables us to run more people through the mass vaccination clinic because it'll be a bigger facility. And yes, it does allow us to prepare the Surge Centre for what we anticipate will be an increased caseload in terms of unvaccinated people in particular contracting the virus over summer and needing hospital-level treatment. So that's the transition that we are looking to make in this intervening period, is that we built the Surge Centre for a specific purpose, but it was multi-use. And over the course of the pandemic, it will be both a medical treatment space, a testing centre, a vaccination centre, and it will serve a really useful purpose.
Chief Minister, what role do you see for rapid antigen testing, particularly for the construction sector, for example? We know the disability sector has been pushing for its use as well. What do you see as its role?
Well, look, as I understand the technology, excuse me, the technology continues to improve and its reliability continues to improve. It's still not yet at sort of the gold standard of the PCR test. It's not to say that it can't be a useful addition in the surveillance necessary to sort of monitor across particular workplaces or settings. So it will potentially have some role. I'm not an expert in relation to how far the technology has progressed. I'll leave it to the regulators to provide governments with advice as to whether it is sufficiently reliable to be able to rely on it to assist in the surveillance. But it would seem at face value from what I've read and what certainly what the proponents of it are advocating, that it does have a role to play.
You've mentioned a few times about increasing vaccination across New South Wales and here and slowly easing restrictions. Are you able to just shed some light on the thought process between what vaccinated Canberrans will be able to do in the coming weeks and months, especially in relation to opening up Sydney or being able to travel to and from once both locations reach a suitable level?
Yeah, okay. That's still several months away, I think. I mean, Sydney is still going to be in lockdown for at least another month. Our hope is that the measures we have in place now would allow us to emerge from lockdown ahead of Sydney. But we don't go through what we are going through now with a view to just invite Sydney to bring the virus straight back into Canberra. So I put it this way, I would not be planning a trip to Sydney in the next few months. And I go back to the point I raised in relation to Jasper's question, that it would seem that much more freedom of movement around the nation is more likely in December and more so into 2022.
Just on us scheduled to finish our lockdown on the 2nd of September, currently regional New South Wales I think is scheduled to come out on the 28th of August. Do you have any update about what that discrepancy means for the ACT or how we're going to progress forward?
Well, look, I don't know yet what New South Wales will do in relation to their regions. I mean, they've still got a lot of cases. Their policy position appears to be to aggressively suppress or seek to at least eliminate region by region the virus outside of the Greater Sydney area. Look, if we have a few days where there's not an alignment of settings, that is what it is. I can't control what New South Wales do, and we need to make decisions in terms of our internal settings based on our own situation. But it would be odd for the surrounding Canberra region to have radically different settings from Canberra, and New South Wales will obviously need to pay some attention to what we do. There's always one mobile phone that goes off in a press conference. New South Wales will need to pay some attention to what we do, because what we don't want is for the virus to seed back into to Queanbeyan or somewhere else based off the ACT. So alignment is good, but we are independent jurisdictions. We have a different approach at the moment. We haven't given up. So we're going to continue to try and protect this community.
Hard borders aside, is there any world where the ACT will have less restrictions than Queanbeyan if they do decide to extend the regional New South Wales lockdown? We saw it flipped when we first went into lockdown.
Yeah, look, it's very difficult to speculate, Dom. I need to see what measures they would put in place. My presumption is that they wouldn't go from lockdown to free-for-all. I don't think they're doing that. We'll just need to see. That's one of the things we take into account. It's not the only thing we take into account.
Businesses have expressed frustration that it's going to potentially take to the end of September before support hits their accounts. Is there any scope to speeding up that process?
Yes, we're obviously deploying additional resources across government to be able to process those applications. What we are balancing here is fraud risk, and what we've seen in other jurisdictions, and this is discussed at the Board of Treasurers, which is the body of the state and territory treasurers. It's been featured in Auditor General's reports on some of the government business assistance schemes that were put in place last year. So the sort of behaviour that has been witnessed across Australia is fraudsters scraping ABN numbers, sometimes even just that are very publicly accessible on a business's website, and seeking to link that ABN to their own bank account rather than that business's bank account. So we obviously need to put in place a range of measures to protect against fraud. That's important because the government's intent is that the money goes to the businesses in need, not to scammers. And in any situation like this, scammers are active, and so that is why we are requiring a level of information from businesses, and why we will be cross-checking, why we will be requiring businesses to keep information for 2 years, why we will be auditing, and why anyone who does the wrong thing will find themselves in significant trouble.
The Royal Australian College of Physicians has called for National Cabinet to prioritise return to school guidelines, including vaccinations for school communities. Do you think that's worthwhile?
Well, we certainly all have to manage return to school. We need to understand the vaccine availability. That's obviously largely draws a distinction between high school age kids and primary school age kids in terms of what's currently available. So yes, we do need to be talking about this. I know parents want us to be talking about this. I know parents are concerned not only about being able to access vaccines for their teenage kids, but also for their primary school age kids. But at the moment, we don't have an approved vaccine for under 12s. But this definitely needs to be talked about, definitely needs to be considered in some detail, and is a major priority.
Is the government considering mandating vaccines for people working in the construction sector? Is that something being considered by the government in order to reopen that industry?
Look, this question's been asked every day, so I don't have a different answer today from yesterday. The problem with mandating when not everyone can access a vaccine is that you are excluding people who haven't yet had the opportunity to get vaccinated. A number of states have formed a subcommittee of National Cabinet. I think from memory it was Victoria, Tasmania and the Northern Territory, to present to National Cabinet a range of options for consideration of what privileges, if you like, or what benefits will be accrued or given, granted, allowed to people who are fully vaccinated. And there are some workplaces where that may well be a requirement. My message to the construction sector is that we are aware of your desire to reopen. We're aware of your desire to have reopened 2 weeks ago. No one wants to be in lockdown. No one wants to be in this situation. But the best thing the construction workers, the construction bosses, the MBA, all the people involved in the industry can do now is get their staff vaccinated. If you're a tradie, get vaccinated. That's certainly going to make it a lot safer for you when you go back to work. And the more people who are vaccinated, the more quickly we can move out of the situation that we are in now. So please come forward and get vaccinated. That's going to speed things up.
What about disability workers who have all had the opportunity and we have priority spots to get them vaccinated?
Well, we're continuing that program. So we want to get as many people vaccinated as possible.
I'm sorry to bring up the Merimbula sewage again. John Barilaro has directly pointed at the ACT as the cause of that. What is your response to Mr. Barilaro?
Does John know something about the poo that other people don't? I don't know where he's getting that from. I mean, if he's got scientific evidence that can back it up, that it's Canberra poo, okay, all right. But, I mean, seriously, I'm just not interested in having whose poo it was arguments with John Barilaro at the moment, to be honest. Jasper.
Question for the Deputy Chief Health Officer if everyone's...
No more questions on sewerage? No, okay, all right. Well, look, thank you very much. I'll hand over to the Deputy Chief Health Officer.
Yesterday, 30 new cases were announced and we were told that 25 were linked and 5 were under investigation. Are you able to give an update for the total outbreak of how many mystery cases there are? Of the total active cases, how many are linked to known outbreaks?
Sure. So obviously there are a couple of interviews that are still ongoing from the numbers that I released this morning and the Chief Minister talked about. But it's my understanding that we have not been able to identify a source for 8 cases at this stage. And that's after some significant investigation, so after some days have passed. And some of those are the index cases or the first cases of some of the clusters that we've been talking about. So we still don't have the source for the index case to this whole outbreak.
And can you confirm that contact tracers are now looking back to the 2nd of August in their investigations to try and determine where the virus entered the ACT?
Yeah, contact tracers are continuing to undertake intensive source investigation, interviewing and investigation in terms of our initial index case, who may indeed not be the first case that sparked this outbreak. We just don't know. So I can confirm that those investigations are ongoing.
Are you able to provide the numbers linked to those transmission sites? So how many cases of transmission we've seen at each of those transmission sites?
Yeah, I can. So the number of cases at Bright Bees Early Learning Centre in Nichols is 10. CIT Reid, which is a new site of transmission, is just 2 today. Gold Creek is 2. Downer Community Centre is 12. Fiction Nightclub is 31. Assembly Pub is 4. The Lennox Jaguar Land Rover dealership is 15. Lyneham High School 40. Belconnen Basketball Stadium 7. And Southern Cross Basketball 33.
Do you know the age and vaccination status of the individuals in hospital, particularly the one in ICU?
The individual in ICU is in their 40s. They are unvaccinated. I don't have the others, I'm sorry.
Given it's almost 2 weeks now since that index case has been under investigation, are our contact tracers and ACT Health absolutely certain that we do not have any holes in our either border monitoring or our exemption regime, given that we still can't trace down where this case came from? Two separate transmissions where they came from?
Yeah, sure. Look, that's a good question. I think what we've seen, particularly throughout this year and particularly in the context of the New South Wales outbreak, is no matter how tough your border restrictions are, and I'm thinking about Victoria and Queensland in particular as neighbouring jurisdictions, other neighbouring jurisdictions to New South Wales that have very tough border restrictions, there are incursions that still happen. Unfortunately, there are some people that are not abiding by the rules and for whatever reason getting through those very tough border restrictions. So we've talked a lot here about how difficult it is being an island within New South Wales with a lot of essential workforce, students crossing the borders, how difficult it is actually to close our border, impossible actually, to close our border to regional New South Wales. But even if we could, that wouldn't necessarily mean that we wouldn't have those incursions. So this is the way of the future, and it's why the vaccination rates are so important to get up.
There are now 10 cases connected to Bright Bees. Are you able to provide a age breakdown of those 10 cases? I think there's a little bit of panic among parents about whether Delta is now spreading through our preschool kids.
Yeah. Look, there are children and adults involved in that outbreak. I don't really want to go into the age breakdown of every single cluster, so I'm not going to do that today. I understand the concern of parents, particularly of very young children. It is, in an early learning centre like this, it is harder to maintain social distancing, some of the behaviours that are much easier in a primary or a high school. So I can certainly understand that. What I can say is that we're not seeing any severe disease among children up to this date. And that has been the national picture. So that while they're still not eligible for vaccination, that at least what we're not seeing is the severity of disease that we're seeing in older cohorts. And we're doing everything that we can to curb that transmission.
What about a breakdown then of how many are children and how many are not?
No. So, because then I'm going to be asked about a breakdown for every single one. There are children and there are adults.
An update on Coolum Court. Has everyone been tested? How many people are in isolation? Has there been any more cases arise?
Sure. Condamine Court? Yeah, no worries. So things are going very well there. So since the update yesterday of the close contact of the index case of that cluster, there are no further positive cases. Some more individuals were tested yesterday that were missed in the first round. There's to date, no one has come back positive. I don't have details of whether all those 15 are negative today. What we are doing is considering how we might best support those residents moving forward. Given they are all close contacts. And so there are a lot of social and clinical supports, mental health and other supports on site, and when it might be more appropriate to test that group again. So the plans are well underway. We're really happy with how that's going at the moment.
On contact tracing, can you provide an update on contact tracing capacity in the ACT?
Yeah.
With the number of exposure sites and active cases now, is the ACT slipping behind in case interviews at all?
Not in the case interviews. So what we do is we definitely prioritise our case interviews. So we'll do an initial interview and make sure that the individual is not a high-risk worker or from a high-risk setting, and they're triaged first. But no, we're still getting through full case interviews within 24 hours of notification, which is the national gold standard. It's the metric we need to meet. In terms of contact tracing, we have thousands, tens of thousands of people, and we have surged our capacity significantly, both here in the building, but also interstate. So we have great support from Western Australia Health and Tasmania Health in helping us remotely do that contact tracing, which is fantastic. Again, in contact tracing, we're prioritising those close and social contacts to call first, and then those contacts that are from those transmission sites. With just so many, it's increasingly challenging to be able to call all of those contacts, but everyone is getting the message and their directions as to what to do via SMS and email to what their requirements are under the public health direction. And if anyone's got any concerns or they feel like they should be called and haven't been called, then there is the COVID helpline number is there to call to speak to someone.
We're seeing case numbers really jump. Yesterday was 30 and then we've dropped down to 9 today. I just wanted to ask you as the expert whether you can provide any explanation for why we're seeing that. Is it due to low testing numbers and then high testing numbers? How are you interpreting those numbers jumping around?
Yeah, I think I certainly am hesitant to say that we're on the downward trend at this point in time. So, a day of single digit numbers is not a trend, and I wouldn't be surprised if we have double digit again tomorrow. But I think a lot of it has to do as to when different cohorts also come up to their exit testing. So we would have exit tested a lot of Lyneham High School and other school contacts yesterday, and those test results are just coming through the system. So I'm cautiously optimistic, but we need to see a couple more days play out as people start to get to their day 10 to 12 exit test. To see what those numbers are doing. Now, if they start becoming positive at the end of their quarantine period, we'd expect they've been in quarantine for all of that time that they're infectious, so they don't pose a risk, but they will make our numbers go up again.
For the Health Minister. Can you provide an update of the number of ACT Health staff, clinical staff, who are currently not able to work because they're in quarantine?
Yes, so I can let you know that the number is slowly going down. So we now have around 650 staff across Canberra Health Services and Calvary Public Hospital who are currently in isolation or quarantine and unable to come to work. So that's about 50 fewer than yesterday. And the teams continue to bring people back to work safely as soon as they can do so and support those people to return to work. Of course, we're continuing to proactively recruit staff as well, and the last I heard we had about 500 responses. I think I might have mentioned yesterday we had about 500 responses to that call out, and I think we've brought on board at least 100 people out of that response. So again, thank you to everyone who's putting their hand up to support the response to this outbreak.
How is the Deputy Prime Minister able to be in federal parliament without quarantining but coming from a hotspot?
So there are exemptions obviously in place for parliamentarians as essential workers, and I can't speak specifically to that. That's a matter for the Chief Health Officer, but also the Chief Medical Officer and the arrangements within Parliament as well in relation to the specific arrangements for the Deputy Prime Minister, but I can't speak to those.
You announced one new case linked to the disability cluster. Could you provide a breakdown of cases, how many we have now and how many people are with the disability support workers? And I think there was one tradesperson caught up in that outbreak as well.
Yes, so I probably can. So I don't have actually those numbers across the system on me, but hasn't changed from yesterday except for the addition of one person with a disability. So I haven't got unfortunately I haven't got the breakdown today, but I think that takes the overall number to 15 from 14 yesterday.
Just with those nurse applications, how many of those 100 or 500 do we have to register to get back in? And are you able to confirm, will the government be covering the costs to re-register those nurses?
I'm not able to confirm that, no. We have obviously raised this matter with the Commonwealth in relation to the processes through the national regulator, APRA, and I don't have a number on how many needed to be re-registered. I certainly know that some people have come back from fairly recent retirement from the system and didn't require re-registration. Other people have indicated that they're happy to come back to roles that don't necessarily require registration. Yes, that's where we're at the moment. I can't give you an answer on. I don't think that at the moment we're paying the APRA registration fees, but what we are doing is working with the College of Nurses to ensure that people can get access to their support, online support to that is required to return to the workplace. For some people, not everyone, as I said, will require that.
Given that we've been watching Sydney closely for a while, how come we didn't have some sort of waiting list or list where we could have put recently retired and people on holidays, for example, nurses, that we would be able to call up quickly and increase our surge capacity should this have happened?
So we have previously had this before. I don't think. Look, I think there were processes in place, and obviously we moved very quickly to streamline the process that had previously been in place. We had certainly reflected on the commentary from people that the last time we asked for these workforces surge capacity, which obviously we had that list of expressions of interest from previously, that it had been a little bit of a cumbersome process, and so they were very quickly able to respond to that, to streamline that process and put in place a phone number for people to call.
Could it be streamlined further?
The feedback I've had is that it is pretty streamlined at the moment, but obviously if people have specific feedback about the process, we're very happy to take that on board.
One more on Condamine Court. We've heard reports of people leaving the premises at night. Are there any sort of security or any sort of measures or monitoring that is conducted by ACT Health to make sure people aren't leaving when they're supposed to be in quarantine?
So there is a limit to the amount of restriction that can be placed on an environment like that, but what we're trying to do is to support the tenants to ensure that they can quarantine safely, that they have all of the health and social supports that are required for them to be able to maintain their quarantine safely, and that is something that's continuing to be monitored by ACT Health as part of that multi-agency response that's being put in place. It's very much a person-centred response to support people to quarantine safely.
Check-in CBR, would the ACT government look at a QR code card like was rolled out in New South Wales 2 weeks ago to show at venues or businesses to help DV survivors who don't want to keep a record of their movements on their phone?
So you can actually choose an option in the Check-in Canberra app to not have the record of your movements displayed on your phone. So you can have that hidden. There is an option in there. I'm sure that there is an option in there that you can choose to not have your history visible on your own device. So obviously that information would still go to ACT Health, but it wouldn't be visible on your own device. Great, thank you. And Lucy will get you those numbers in relation to disability.